My name is Danielle Swerg and I'm a Diagnostic Medical Sonographer. Sonography or ultrasound is a diagnostic medical exam that uses sound waves to produce dynamic images of organs, tissues, and blood flow. Ultrasound can be used to evaluate many parts of the body such as the abdomen, female reproductive system, breast, the heart, blood vessels, superficial structures, and MSK. It is also used to guide in fine needle tissue biopsies to assist in taking a sample of cells from an organ for lab testing. You can specialize in general or echo sonography. General consists of just looking at the abdomen, breast, OB, gynecology, MSK, neurosonography, or vascular. And then echo specializes in the heart, and specifically in adult echo, fetal echo, or vascular. Next, I will be showing an example of a shortened right upper quadrant exam done to look at the pancreas, the liver, the gallbladder, the common bile duct, and the right kidney. Now I'm going to go over a right upper quadrant protocol that we do for any abdominal pain that the patient is having, any gallbladder abnormalities like nausea, vomiting, or pain after eating. And also we get these for any elevated liver enzymes. So first you look at the pancreas, which is right here. You can see right here. Then next you look at you can go ahead and breathe. Next you look at the liver, which is right here, and you scan all the way through. The liver is a really large organ, so you have to make sure you scan all the way through. This is still the liver right here, looking for any abnormalities or any lesions or masses that you see. Still the liver there. Also, you can look at the blood vessels, so what's bringing the blood into the liver and out of the liver, and that shows up as color here. Alright, and next we look at the gallbladder. Which you can see as this black area here. Looking for any stones or any abnormalities. And then after the gallbladder, we do look at the common bile duct. It's what drains the bile out of the gallbladder to see if it's dilated or if there's any stones at all in there. And then lastly, we look at the right kidney. Which you can see right here. The right kidney sits behind the liver there. Scanning all the way through, looking for any masses or any abnormalities with the kidney. And then that completes a right upper quadrant protocol. Next is an example of what the heart looks like on ultrasound. There are numerous steps that need to be done when performing a protocol of the heart. This next video clip is just showing what the heart looks like on ultrasound. Alright, so now we're going to go ahead and take a look at the heart. You can see here all 4 chambers really nicely. And also what we want to do is look at the blood flow through the heart. So we turn color on and you can see the color there as the blood flow. And then we also look at the velocity and how fast the blood is moving through the heart. And then you want to be looking at all 4 valves and all 4 chambers and the overall structure and function of the heart. This last clip is of the carotid arteries, which both general and echo sonographers scan. Another protocol we do is looking at the carotid artery, which brings blood flow up to the brain and to the face. So here you can see the carotid artery as that black tubular structure there. And here we just want to look for any plaque that would show up white on the screen. We also want to turn color on to see how the blood is moving through the carotid artery. And then we also want to get a velocity to see how fast the blood is moving through the artery. And then we get a waveform just like that there, and then we measure the peak, which would give us the velocity and how fast the blood is moving through the carotid artery. Sonographer's responsibilities include talking with patients about their history and signs and symptoms, performing the ultrasound exam, obtaining diagnostic images, analyzing these images, using independent judgment when finding any pathology or abnormalities, providing the radiologist with a summary of your findings, and providing quality patient care. A typical day as a sonographer starts with looking at the schedule for the day. You want to look up the patient history, patient information, and why we are doing the exam. Next, you want to make sure the machine in the room is ready. After that, you go get the patient, bring them into the room, explain the exam, and ask any questions you might have. You then do the exam, and after the exam is over, you talk with the radiologist and let them know your technical findings. After that, the patient is then free to leave. You clean your room, and it's on to the next patient. Sonographers can work in clinics, hospitals, private practices, public health facilities, or laboratories. Now on to schooling and how you become a sonographer. Diagnostic Medical Sonography programs vary from 2 to 4 years depending on the degree and certificate awarded. You can look at caahep.org, which is caahep.org, to find which programs are accredited. Lastly, would you enjoy using high-tech ultrasound equipment to capture images from inside the human body? If so, then ultrasound is the career for you.